Hey, what's up? It's Privacy J here. It's time for another Sunday's live stream. Now, before we go to the topics, I just got a first dose of the vaccine. So that was like last Thursday because so this week it was a spew week. And also, just a reminder, I'm getting a second dose of the vaccine. It's coming on June 11th. So, because on Monday I'm gonna wear a Panther shirt, like a T-shirt, and Tuesday is a Rainbow Day because of that, and also on Wednesday, Thursday, and Friday because U.S. or New York, we'll have to find out and see because so keep in mind. So yeah, move along to so today's COVID updates and vaccination updates. So before we do that, May is almost over, but June is coming, June 1st. So summer is almost here. Spring is there. So, so the vaccination update is 18,377,799 total doses administered. 63.5% of New Yorkers of age of 18 plus and up with at least one dose. 51.9% of all New Yorkers with at least one dose. 97,778 total doses administered over the past 24 hours. And 54.7% of New Yorkers of the age of 18 plus with and up with completed vaccine series. 43.9% of all New Yorkers with completed vaccine series. Now, move along to the next one. Now, the total hospitalizations is 1,335 total hospitalizations, which means it's still decreasing and it's down. It's dropping, but it's almost over. So, yeah. Anyway, let's moving on to today's topics. Excuse the ads. Now, we're gonna talk about an 8th U.S. state just reached a critical COVID-19 vaccination update. So, I'm gonna quick read. I'm gonna let narrator go. As U.S. officials push for more vaccinations amid slowing demand across the country, another state has now crossed an important milestone. Your turn, narrator.
Rhode Island is now the 8th state to have administered at least one COVID-19 shot to 70% of its adult population, according to data from the Centers for Disease Control and Prevention. The state joins Connecticut, Hawaii, Maine, Massachusetts, New Hampshire, New Jersey, and Vermont, which have also vaccinated at least 70% of their adult population. The news adds on to experts' optimism about the country's declining COVID-19 case numbers and where we could be by summertime as vaccine numbers continue to climb. Earlier this month, President Joe Biden set a goal of administering at least one COVID-19 vaccine dose to 70% of American adults by July 4th, and has said Americans will be able to celebrate Independence Day by then with a true semblance of normalcy.
Hey, what's up, Hamza? Just reading another articles about that. So I'm will read the related article. COVID-19 vaccine boosters may be necessary. Here's what you need to know. Narrator.
So far, more than 61% of U.S. adults have gotten at least one COVID-19 shot, and more than 49% are fully vaccinated, according to CDC data. And nearly 49% of the total U.S. population has received at least one shot, and nearly 39% of the population is fully vaccinated. that data shows. But the demand for a shot is down, and experts worry that slowing vaccinations may mean some communities don't reach the widespread protection levels that officials hope for and continue to face outbreaks. I think we'll be dealing with COVID-19 for quite a long time, unfortunately, emergency room physician Dr. Rob Davidson told CNN on Saturday, when asked what could happen if the country doesn't vaccinate enough of the population. According to CDC data published on Thursday, the average daily pace of COVID-19 vaccinations was down almost 50% from its April peak. We just have to keep pushing forward because, thinking about what could happen if we don't get there, I just think we have to keep using every resource we have to get more people
Vaccinated, David said. You missed it. Now, um, the the barriers to vaccines that persist. Um, there are still several challenges officials are working to overcome in the country's vaccination efforts. Experts say many Americans still have questions about the vaccines, haven't received enough or the right information, and others has problems with access, including being unable to take off of work or to go get a shot. Return.
Employers not only have an opportunity to increase vaccination rates, but it turns out that they can also help to close the equity gap in vaccinations. U.S. Surgeon General Vivek Murthy said during the White House COVID-19 briefing on Friday. This is so important because we've said from the beginning that success is not just determined by how many people we get vaccinated, but by how equitably and fairly we vaccinate our population, he added. And workplaces, it turns out, can play a role in that.
Keep on going.
CDC Director Dr. Rochelle Walensky also said last week the agency was asking businesses to support their employees to get vaccinated. We are really asking the businesses to work with their workers to make sure that they have the paid time off to get themselves vaccinated so they can be safe, she told CNN last Sunday. The next phase of the country's vaccination is an all-hands-on-deck approach, Murthy said Friday, driven by communities themselves. Please reach out to your family and friends, he said. Remind people the vaccine is free of charge. It's now easier to get than ever before. And remind people also that the vaccine remains our single best pathway out of the COVID-19 pandemic. Track COVID-19 vaccinations in the U.S. It's okay if you're not ready to take off your mask. The ongoing vaccine push also comes as parts of the U.S. are still navigating the recent CDC guidance, which said fully vaccinated Americans can, for the most part, ditch their masks and don't have to practice social distancing. The guidelines trigger a wave of policy changes across the country, from both state leaders and businesses. But some vaccinated Americans say despite the new guidance, they don't feel ready to shed their face masks and go back to crowds.
I'm gonna read that related article again. What's the new CDC mask guidance means for kids under 12? Your turn.
And that's okay, Dr. Anthony Fauci said Friday. Fears like that are not irrational, Fauci said during the White House COVID-19 briefing. You can understand that when people have been following a certain trend for a considerable period of time, that it may take time for them to adjust. So I would not say that that's irrational, I'd say that's understandable. Walensky, with the CDC, has also previously said that fully vaccinated immunocompromised people, who may still face a higher risk, should consult with their doctor before deciding whether to stop wearing a mask. As more Americans get vaccinated, it will become progressively more safe to be out and about again, Dr. William Schaffner, an infectious diseases professor at Vanderbilt University, told CNN on Saturday. If we're vaccinated, that vaccine is going to provide us very, very good protection, he said. But we need these other people to come in and be vaccinated also, and that will also help address concerns about whether to mask up or not, Schaffner added. We'll solve this problem. We don't have to worry about who's wearing a mask or not, if we're all vaccinated, he said. Vaccine incentive programs appear to work to help get more shots into arms. Some state leaders have rolled out specific incentives for their residents, including roadmaps to normalcy and cash. Vermont Governor Phil Scott said Friday the state will remove all remaining COVID-19 restrictions when 80% of the state's eligible population has received at least one COVID-19 shot. If you are on the fence, or have not gotten around to making your appointment yet, now is the time, Scott said, because we have a chance to get back to normal faster and it has never been easier to get vaccinated.
Now, the related article, New York and Maryland follow Ohio in creating COVID vaccine lottery. Your turn.
Other governors have announced lotteries, and those programs appear to be working, White House senior COVID-19 advisor Andy Slavitt said Friday. I think the reason they work is because the vast number of people who are not yet vaccinated are actually not opposed to getting vaccinated, they're just not prioritizing it very high, Slavitt said. So things that draw attention to it, like the lotteries, are, not surprisingly, very effective. New York Governor Andrew Cuomo announced adults who get vaccinated in certain mass vaccination sites this week will be given a lottery ticket with a chance to win as much as $5 million. Maryland Governor Larry Hogan said starting Tuesday, the state lottery will randomly select a vaccinated resident for a $40,000 prize every single day, and those drawings will continue for 40 days. On July 4th, a final drawing will be held to award a vaccinated Marylander a grand prize of $400,000, Hogan said. In Ohio, where the governor recently announced a weekly drawing for vaccinated residents, health officials said last week the cash incentive is making a difference. Since its May 13th announcement, the campaign helped drive an increase in vaccination rates among Ohioans 16 and older by more than 28%, Ohio's health department said in a news release. Prior to the announcement, vaccinations in residents 16 and older had seen a decrease, the department said. CNN's Virginia Langmaid, Rebecca Reese, Melissa Alonso, and Deidre McPhillips contributed to this report.
All right, next topic. How New York City is slowly but surely rebounding from COVID-19. Experienced experts says that the city is slowly showing signs of strengthening. Okay. I'll read the first paragraph. Mayor Bill de Blasio said the goal is 100% capacity is most businesses by July. But Broadway is not expected to fully reopen until the fall. More than half the country is seeing the COVID-19 cases fall. Your turn, narrator.
This week marked a major milestone for New York City during its 14-month struggle with COVID-19. Subway service returned to 24 hours, capacity limits on indoor restaurants, workplaces, and recreational spaces were lifted, albeit with distancing requirements, and the more than 3.2 million fully vaccinated residents were allowed to go maskless. While local leaders and businesses cheered the moves as a signal that the Big Apple will soon be back to its pre-pandemic heyday, urban planning experts tell ABC News there is still a long way to go. More COVID-19 cases have stopped declining in New York City. Experts are trying to find out why. The pandemic forced the city's workforce to conduct all of their business from home instead of offices, leaving whole real estate spaces in the city's skyscrapers vacant. And a recent survey of employers found that a little more than half of their employees are expected to return. People wearing face masks walked through Times Square, May 17, 2021, in New York City. Getting those vacancies filled will take time, according to Jonathan Peters, a professor of finance in the business department at the College of Staten Island. The real question is, when you shock a system like this, does it return to the original position? We're all seeing what happens, he told ABC News. Still, Peters and other experts predict that, given time, New York will be back to its bustling self because of its strong foundation built on arts, commerce and, most importantly, its history in adapting to crises. The state of the city. Starting May 19th, New York City capacity limits were lifted for several indoor sectors. However, businesses are still required to have 6 feet distance between people. The state-mandated indoor social gathering limit increased from 100 to 250 people. Entertainment venues and sports arenas are allowed to have crowds of 500 people outdoors or 250 people indoors if the attendees showed proof of vaccination or a negative coronavirus test, according to the rules. Fully vaccinated people can go maskless, except in the subways, hospitals and a few other locations.
Now, keep on going.
Governor Andrew Cuomo credited the city's falling COVID-19 cases and spring jump in vaccinations as the main factor behind the rollbacks.
Yep, that's the COVID cases right there, as you can see. So yeah, it's going down. It's keep going down. The numbers going down. So yeah, narrator, keep on going.
As of May 19th, the 7-day average of new coronavirus cases reported was 629, a 1,700 drop from April 19th, and over 7.6 million vaccine doses had been administered, a 1.8 million jump from April 19th, according to the city's health department. While other states such as Texas and Florida reopened at the end of March, Peters said New York's timing was right. It would have been more costly if the city relaxed its health guidance when transmission rates were high and vaccine rates were low during the late winter and early spring, he said. You need to keep bringing the heat up slowly, he said. Office return delayed. Based on recent data from New York's business community, a return to normal will certainly be slow. New York business and real estate experts predict that the bustling office environment of the pre-pandemic days won't be coming back until fall at the earliest. Survey results released in March by the Partnership for New York City, a nonprofit organization that consists of hundreds of the city's CEOs, found that 22% of employers would require their teams to return to the office full-time, and almost half of office workers are expected to return by September. Some major companies are moving ahead with the return to their cubicles.
Keep on going.
Earlier in May, Goldman Sachs sent a message to its employees to make plans for a return to their offices in June, the New York Times reported. Google, which purchased more office space in Manhattan last year, is slated to begin bringing back its employees in September. Melvin Miller, CEO of the Association for a Better New York, a nonprofit business advocacy group, said the real challenge will be for small and mid-level companies to return to their spaces. She acknowledged that remote work options were already changing the city's office structure before COVID-19 hit and said the pandemic will make it hard for the genie to go back into the bottle.
That's the COVID-19 tracker right there, as you can see. So yeah, narrator, keep reading.
However, Miller noted that New York has previously adapted to changes from crises, such as 9/11 and Hurricane Sandy. Miller said after both of those events, there were concerns that downtown Manhattan wouldn't be seen as a viable location for future businesses in development, but the area boomed with business in the years that followed. Each of those crises were different, and we had to approach it differently, Miller told ABC News. More, New York City, Once the COVID-19 epicenter expands indoor dining to 75% capacity, she noted that real estate managers were already coming up with ideas on how to maximize the unused office space. Some buildings are offering tenants open floor plans that emphasize shared spaces and multiple startups on one floor, Miller said. Mixed-use developments such as Chelsea Market have already shown success renting out floors for store space while also leasing offices, she said. She predicted that the city will see more of these ideas going forward, even as work-from-home options stay popular. What I think needs to happen is that businesses allow for that office traffic, Miller told ABC News. We need them to be open to opening up more stores and restaurants on the ground level that gets people on the streets and want to get back into the city even if they have the option to work from home.
Keep going.
Signs of rebound underground. Experts said initial mobility trends are showing that New Yorkers are starting to get out of their homes. Robert E. Poswell, a professor of civil engineering at the City College of New York, has been studying New York's mass transit trends and told ABC News they're a key indicator of the city's viability. Data from the New York City Transit Authority shows that the 7-day average of subway ridership has been steadily increasing since February and reached an annual peak of nearly 2.7 million riders on May 14th. Although this number represents a 60% drop from the pre-pandemic equivalent of the same day, it is a far cry from the six-figure spring 2020 ridership numbers.
Okay, so the MTA subway ridership is the NY state opens vaccine to all residents age 16 and up. That's April 6th, a couple weeks ago. All right, narrator, keep reading, please.
At the same time, City Bike, New York's bike share program, recorded 631,314 rides during the week of May 9th to May 15th, the highest number in its 8 years of operation, according to officials. This to me shows New Yorkers want to be where things are happening, Poswell told ABC News. They don't want to be at home. Poswell, who used to run Chicago's transit system, predicted that subway ridership will continue to increase as New Yorkers feel safer. He added that the urge to go out will also be strong whenever offices allow their employees to come back. They want to be back in their offices. It'll be slow at first, but generally people don't want to be at home working all day, especially if they have children and in-person school resumes, he said. Poswell and other experts said the key trigger for getting people out of their homes and boosting the economy is the rebound of its arts and culture scene.
Keep reading.
The warmer weather and early reopenings have spurred people to re-explore the arts, restaurants and other attractions that the city has to offer. It's like putting your toe in the water, Poswell said. Broadway boost. In September, Broadway shows are scheduled to reopen at full capacity. Smaller concert halls and theaters are predicted to open earlier. Large-scale events are also scheduled to return later in the fall, including the New York City Marathon in November. More, Broadway, New York theater scene to reopen in September at full capacity. Poswell said the return of such events is important for New York's tourism industry, which pre-pandemic covered over 291,000 direct jobs and more than $47 billion in economic spending, according to the Office of the New York State Comptroller.
All right, so keep on going. Where do we start at?
We're already starting to see hotels get booked up and people in Times Square and other tourist spots again, he said. Miller said these reopenings will do more than just restart the critical parts of the city's economy. Having the lights on in Broadway and other hotspots sends a message to the world that New York City is past its worst days of the pandemic, when hospitals were filled to the brim and the daily death count was in the hundreds, according to Miller. This in turn could help bring back the estimated 70,000 people who left the city in 2020, she said.
All right, guys. So that was your Sunday's live stream. Because stay tuned for the next Sunday stream. So where I will let you guys know when to do this to the next topic. So almost there to June. So if you're going to subscribe for more content to Privacy J Productions and to Privacy J Productions 2, all of my social medias will let you know all about it. Facebook, my name is Jaden Garcia, and Instagram is JTech727, Snapchat is Scoots0727, and follow me on Twitter at PrivacyJNYC1. So thanks for watching, and peace out.